Welcome to Question Time. On tonight's panel, Robert Buckland, the Government's Justice Secretary and former Solicitor General for England and Wales. Labour's Shadow Health and Social Care Secretary, previously on the front bench under Jeremy Corbyn and Ed Miliband, John Ashworth. Caroline Lucas, twice leader of the Green Party, elected to Westminster in 2010, where she remains the sole Green Party MP. Joining us down the line, Kate Andrews, former Associate Director at the Institute of Economic Affairs, now economics correspondent at the right-leaning Spectator magazine, and for many years Chief Executive of the social justice charity Turning Point and a crossbench peer for 20 years, now Chair of the NHS Confederation, Victor Adebowale. Good evening. Welcome to my guests here on the panel. Kate Andrews, very good to see you. Welcome to you down the line. And welcome to our QT50, our audience. Some familiar faces in there, of course. And welcome to you at home. Thank you very much for joining us. And if you want to join in the conversation on social media, you know the drill, at BBC Question Time, and we'll hear what you've got to say. So, our first question tonight is from Dale Jackson.
Hi there, Fiona. Thank you. Yeah, my question is, do you think it's double standards and hypocrisy allowing footballers VIPs in the UK without quarantining whilst lockdown is still in place, which I kind of think is wrong?
So you obviously do think it's hypocrite. This is about 2,500 UEFA dignitaries and sponsors are going to be allowed to come to the Euros final without having to quarantine wherever they come from.
Yeah.
And you obviously think it is hypocritical.
Well, it is, because the government are asking us to stick by the rules, quarantine and do our social distance and everything else, and doing our tests and things. But yet they're still allowing people coming in from the UK, into the UK, sorry, that are not having to quarantine. And that's wrong on so many levels. You can't then ask the public to do something and then the government, who are hypocrites, to do something completely different. And then the G7, that's another example, and Boris Johnson on another example too. And I stuck by Boris to start off with, where lockdown has happened and we needed to stick by the rules. But now, he's overstepped the mark, and so has the government on more ways than one.
John?
Yes, I agree with you, Dale. I mean, you're absolutely right. And I cannot see how it can be possibly justified that UEFA VIPs, sponsors and so on can get round these quarantine rules and go and watch the final at Wembley. Fans should be able to go and watch the final at Wembley, and we should have and there will be, no doubt, a testing regime in place. I was very lucky to go to the FA Cup final and watch Leicester City win, and I'm a... You
just had to mention that, John, didn't you? Yeah.
As a Leicester MP. But we all had to be tested. We had to be tested before we went, and then we had to be tested after the event, and we had to show our test result to get in.
But isn't the point that the final might not happen here if these dignitaries are not allowed in?
Well, we have to negotiate with UEFA on that, but we cannot be held to ransom. We know that this virus, sadly, remains extremely dangerous. Now, I'm fed up of these sodding restrictions. Am I allowed to say sodding on the BBC?
You definitely are.
I'm fed up of these restrictions, right? I'm sick of them. But I'm also aware that since the 1st of May, we've had 260,000 confirmed cases of this virus. In the last week, 80,000. In the coming weeks, because of the way it grows, we're going to see more of this virus grow amongst the unvaccinated. It spreads like wildfire amongst the unvaccinated. That's Matt Hancock's words. And yes, for those who are vaccinated, the link between hospitalisations and deaths has been reduced, but it has not been severed. And many of those people who get the virus today, tomorrow, next week, even if they don't end up in hospital, although some of them will, many of them will live with long-term serious conditions, debilitating conditions, whether that's fatigue, memory loss, for some it's anxiety and depression. For some it presents as hair loss, teeth loss, some even suffer psychosis. It remains a very serious, deadly virus, and we should not be complacent. We should not be complacent, and I believe this particular decision around the final at Wembley is complacent, and, you know, we've got to change it.
Kate?
It's deeply hypocritical, the idea that you would have VIPs flying in from all over the world not having to quarantine when we can legally still not host 7 people or more than 2 families in our home. And they're taking us for fools. We all watched Billy Gilmore hug his teammate. He wasn't wrong to do so, but when he tested positive for COVID, the team should have isolated, because if a child tests positive for COVID, the whole class goes home from school. And, you know, if an office worker tests positive, the whole office goes home. And basically, we're in a system now where if you can cause the government a big enough of a headache, mostly through lobbying, then you can have whatever you want. UEFA gets 60,000 people at Wembley and their VIPs in. It looks like Formula One is going to go ahead at full capacity. I think Andrew Lloyd Webber did a fantastic thing when he turned down the government's offer to make his new musical a trial. And they offered him that because he was making all kinds of threats, saying he'd get arrested so he could open at full capacity. He gave them a headache, and then they offered him a trial. He turned it down because he knows that most of the theater industry does not have his clout and his power to get what they want. But it is deeply hypocritical and unfair. The G7 as well, that ministers behind the scenes, long lens cameras capturing them, Boris Johnson, the leaders of the world, maskless, standing up, drinking, not social distancing. And there really does seem to be one rule for people who are in government or have access to the government, and another rule now for everybody else. If it is safe enough for Matt Hancock and Michael Gove to be sitting in VIP at Wembley watching the football, and I hope they had a delightful time, then it is safe enough for us to invite a few more friends over to watch the football in our home.
OK, I mean, the government is insisting the rules were followed at the G7. The pictures were there for all to see. Phil?
Thanks, Fiona. It is hypocrisy, and about the closest thing I can say with Robert is, yeah, I'm Welsh as well, and that's about the level I can draw. But on the news tonight, Welsh supporters have been turned away from Amsterdam Airport because they can't go and see the game in Amsterdam, which is being played on Saturday night against Denmark. Denmark supporters can go. Welsh supporters can't go because Amsterdam, Holland have decided that due to the variant in the UK, they do not want Welsh supporters travelling over there. So it's hypocrisy that UEFA can come here from any country in the world, and yet we can't go as supporters to any other part of the world. Total hypocrisy.
Ariane?
250,000 children missed school last week simply because of COVID-related stuff. The vast majority of them had not got COVID. They had been in contact with somebody with COVID. Unfortunately, they're not football players, so they did have to isolate. And funnily enough, Boris Johnson once upon a time said that education was really important, and yet after the G7, Cornwall, a county with very, very few infections, spiked up, especially around Carbis Bay and Falmouth, where the journalists were. What's the communication? I now really don't understand the rules, even though I read them, because it's one rule for them and the rest of it for us. Are we really going to get rid of all the marvellous benefits we've had from our fantastic vaccine programme by squandering it?
So, Robert, not getting a lot of support so far, this idea of letting in the UEFA dignitaries and sponsors, what have you. Isn't it time just for the government to be upfront, say, look, this is a trade-off. We wanted the finals here, and incidentally, we're trying to get in the joint bid for the World Cup in 2030. We'll need UEFA support. So that's the trade-off. And just be upfront with people.
Well, look, I'm absolutely getting loud and clear the message from the panel and indeed from others about the how far we've all come together and how, at this late stage, some things appear to be, frankly, a juxtaposition, a contradiction, a concern.
Well, hypocritical is the word.
I get that.
And do you think it's hypocritical?
Well, look, when I first heard about this, I asked, quite a lot of questions. And, I was asking myself a lot of questions about what was going on here. I mean, John Whittingdale, the minister, yesterday made an announcement about the circumstances in which these people would come. which sounds to me akin to almost hotel quarantine, in the sense they will only be allowed to stay in a designated place, travel in designated transport units, and stay away from other people, akin to, I suppose, a work visit.
So what's the rationale, though? What's the reason the government's doing this and risking the wrath of so many people?
Look, I think the rationale is putting it absolutely straight, that we want to attract a major international football tournament to the UK. And I think that they bring a lot of joy. They also bring, frankly, a lot of revenue for our businesses and our industries across the country. And therefore it is right that we do try and play on that stage, to use an unfortunate pun. But I want to come back to the developing information that I'm getting about the circumstances. There's still negotiations going on with UEFA as to precisely how this would work. And I think the message has to go out loud and clear that this isn't some sort of jolly. It should be very much a focused event on... Well, it shouldn't be a jolly. Look, this is about...
Well, going to a footy match.
I get the point. I get the point. Anything sounding like watching a football match sounds like a bit of a jolly. Yes. But frankly, there is more to it than that. And I think if it is properly controlled and curtailed, then it is doable. But I accept, these are very difficult moments for all of us. I don't pretend this is easy, and there will be other occasions when people rightly will say, well, hold on, why does it seem so contradictory? That is where we're at now, towards the end stages of this common endeavour. But I accept that there will be difficulties like this.
I don't think Robert really believes what he's saying, and it doesn't stack up. Frankly, this stinks, as Dale said. It absolutely stinks. It is deep hypocrisy. And, it's Barnard Castle all over again, and that means it's dangerous too, because at that point, people lost confidence in what they were being asked to do. Everyone has made such huge sacrifices, and then they've seen that thrown back in their faces, back then with Cummings going to Barnard Castle, now with 2,500 UEFA people just being able to barge their way in, and the government putting out the red carpet. It's dangerous because it undermines confidence in the measures. It's dangerous because no matter what Robert says about the extra provisions they're going to take, it's still going to mean you're going to have more people close together coming in from other EU countries where, frankly, the Delta variant isn't circulating to anything like the degree it is in this country. And by the way, let's just remember why it is circulating so much in this country, and that's because Boris Johnson was so inept, so incompetent, so irresponsible that he frankly left 3 weeks before he put India on the red list. And in that time, we now have the Delta variant circulating so much. But Boris says he's going to make, what did he say, sensible accommodations with UEFA. Or what about making sensible accommodations, people might argue, with those people that haven't been able to see loved ones for maybe near on 2 years now? What about sensible accommodations for people who desperately want to have more than 30 people at a wedding? This is just typical of a government that runs the country in a divisive way, that has double standards at its heart, and as I say, it stinks.
Does anyone in our audience, I mean, we were depleted in numbers for the reasons we all know, does anyone support the decision? Charlie, let's hear from you.
Yeah, I'm just actually, while this is going on, I was Googling some figures. There are 10,000 deaths in the last week, according to the government bodies, of which 93 were COVID. It's less than 1%, less than whatever. It's way, way down. The vaccination programme has really done a fantastic job in reducing deaths. Yes, there are 20 to 30-year-olds who are getting the disease, and yes, it's going to teenagers, so it will go round. But it's not killing people so much anymore. It's not doing that. So we have a chance to liberate things. And as Robert said, OK, sometimes we have to play one thing against another. Do we want a cup final? Do we want 60,000 people to actually enjoy themselves?
Do we want a third lockdown?
We have to play it.
Victor.
If I may, well, I think Ariane got it right, actually. The fact of the matter is we need clarity, we need communication, and we need caution. The fact that, if we have... I am worried that we are going to create a super spreader event. It's not so much that these people are going to come into London, it's also how that will be perceived by the people watching it. You know, at the moment, you can't.
Do you mean, Victor, just check, do you mean the dignitaries who are coming without quarantine, or do you mean the 60,000 fans who can go as well?
Thing, and the dignitaries. You know, the fact of the matter is, you know, I'm looking at so the NHS Confederation represents acute trusts, mental health trusts. Just to give you an idea, last week, one of my members declared a black alert. That means that they are over capacity. A lot of my members are at 95% bed occupancy. We have 10 million people, additional people requiring mental health support. We have 5.1 million people on elective surgery. We have exhausted staff. If you're going to ask me whether we should risk that for a football match, and I like football, kind of, my answer is no. It's not worth it. There is no wealth without health. So my view is caution. And honestly, the negotiations around this COVID doesn't negotiate. I think we know that. It does not negotiate. It doesn't care who you are. It doesn't care how important the event is. It will spread. And in London, just to be clear, there's a lot of work to do in London. We've got 37% of adults have had 2 doses. So we're talking about bringing a load of people into a place where we've still got work to do to bring the vaccinations up to standard. Now, I understand the pressures, I really do. I can see it. You know, it's a balance. It's not easy, right? I'm not here to slag off one party or the other, but I can understand it. But the science and the evidence says, no, we shouldn't be doing it. Yeah. And I'll tell you something, the fact of the matter is, when people watch this, they will think, hang on a minute, if they're doing it, why shouldn't I do it? And we've got to this position because people like you have actually obeyed the rules. So we should be really cautious. We should be really clear about what we're saying to people. We should be consistent. Otherwise, this virus will not go away.
Kate, you want to come back in?
Yeah, we should be cautious, we should be smart, but we do need to acknowledge the science. The science says that vaccines work. They are more effective than we ever dreamed they could be, especially against the Delta variant. Charlie from the audience is completely right. COVID patients are taking up roughly 1% of hospital beds right now. The stats that Victor pointed out, I mean, we have very, very serious problems about waiting lists on the NHS, and that is a whole nother topic of its own. But in terms of capacity, this isn't particularly abnormal for the NHS. That's what you get with a rationing system that just doesn't supply as many resources. The issue with this isn't that we're being too cautious, it's that we're picking and choosing who gets their liberty back. We're picking and choosing who gets to be free. If you enjoy the football and you happen to get a ticket, or you happen to be somebody who's wealthy enough that's on a list to fly in as a VIP, then you get to enjoy yourself. But if you'd like to go to the theater, if you'd like to have friends around to your home for a birthday party, you still can't do that. That's the problem. And we are projecting to the world with the G7, with the football, that Britain is open, that everything is back to normal, that it looks something like Israel does, thanks to their vaccine success as well. And we could be like that, but we all know the reality at the moment is actually quite different. Freedom Day was delayed. Many of us are still not able to live the lives that we would like to live. We are pretending to the world that we are back to normal with these mass events. I think it's one of the reasons that they are getting trial status and they're allowed to go ahead. But we know that something different is happening. And my concern is that the government is becoming complacent. They're buying into that projection. They're buying into the idea that that's what Britain looks like. But we know on a day-to-day basis, unfortunately, for many people, it does not.
Natalie.
Can I just come back?
Oh, sorry, Victor, yes, do.
I just think it's important. There's like half of what you said there I absolutely agree with. But I happen to face the people on the front line actually doing the work. And the fact of the matter is, when I say that 95% occupancy is true, what they're worried about is that actually we might have 1,500 people in hospital now with COVID, but it's increasing. That's the point. It is increasing. And hang on, if I may just finish, it's increasing. And on top of that, they have to cope with the demand that's been delayed. So, you know, I agree with you, actually, on the optics of this. It looks bad. It is bad. It's challenging. But we have to acknowledge the pressures are real in the NHS. They're not making this up. It's not a fantasy. They're real, and they're really dangerous. And we have to be cautious about this virus.
They're very real pressures, and they've been there since long before the pandemic. And the pandemic
made them worse. That's what I thought we might agree on.
pressures in the slightest. But if we are to follow the data and not the dates, the SAGE scenario for where we'd be at hospitalizations right now is significantly higher than where we actually are. I just don't want us to talk down the huge success of these vaccines. We need to follow the evidence, and the idea of the NHS being overwhelmed is deeply frightening for many reasons, but there's really good reason at the moment, looking at the data as it is, we know things could change, to think that that link between infection and hospitalization, it's not just watered down, that there is quite a good break. We all keep an open mind on these things, but the Prime Minister in his freedom delay clearly wanted to buy himself a bit more time to look at this data. It's looking really positive, and I think that we should be, quite cheerful.
I think the data's softening the link, but it's not broken. Exactly. That's the point I was trying to make. That's the point about the caution.
And I do think there's a real concern about thinking that vaccination alone is the way out of this. Of course, the vaccination programme has been amazing, and all credit to everyone who's been part of doing that. But on its own, it's not going to get us to safety. And interestingly, Kate mentioned Israel, and Israel now is actually seeing some cases going back up again. Yeah. And the point is that we need to put in place something that this government has failed to do right from the start, which is the basic public health provisions around test, trace and supported isolation, so that we're not only relying on the vaccination, we still need that basic ability to be able to ensure that someone can self-isolate if they've tested positive. And right now we know that huge numbers of people aren't doing that because they can't afford to. So that has to be part of this overall COVID suppression strategy. We've got nearly 2 million people, it was said today, who are living with long COVID. That can have debilitating impacts. I've been part of the all-party group on coronavirus. We've taken evidence from people with long COVID, and it's not just people being a bit short of breath. It's people who've been running marathons 1 month, now in wheelchairs the next. I mean, it is deeply serious. So let us not forget either that we don't have all of our population vaccinated yet. A little bit more caution for a little bit longer, along with some public health measures put in place, will get us to the place that all of us really want to be.
OK. I'm going to move on, because we've got some other questions that a lot of you wanted to hear asked. So let's move on to a question from Gary Day.
Good evening, all. Considering no variants of concerns were detected on any flights returning from the 167 amber list countries between March 20th and June the 9th, when will the government acknowledge that travellers returning from green and amber countries pose little risk to the British public and allow vaccinated people to travel without restriction?
Now, the list has been increased today of countries on the green list, but in terms of very popular holiday destinations for British tourists in particular, I think France, Italy, Germany, Greece, they are still on the amber list. Kate?
Look, I think it's a bit rich for this government to be talking about continuing to curb our ability to travel in and out of the country so greatly when its own ministers and special advisors were traveling during the third lockdown at, frankly, the height of it. You had Foreign Minister Wendy Morton in Greece back in April, taking a lovely tour in Athens to talk about climate change. You had Greg Hans in March in Croatia. He actually did a bit of a tour. I think he was in Slovenia as well, and he flew back to an England where two people were just about to be allowed to sit on a park bench together. Ministers and special advisors haven't had to quarantine in this process. They haven't even had to do testing if they don't want to. I think this feeds into the idea of one rule for some and a different rule for others. But I almost have to take issue with the premise of the question, because as somebody who has had their first jab and is very excited to get their second, I think we still have a few issues here. And we are always going to be living with the hypothetical of a new variant. And again, we should be very on top of this, and we should be concerned if there really is evidence that it could undermine the vaccines. But if we're going to start talking about a two-tiered society where people who have been vaccinated have certain liberties returned and people who haven't don't, that can't just happen through an update through the travel secretary, through the transport secretary. It can't happen through an update at a press conference. It's got to happen in Parliament. There has to be a proper debate and scrutiny over the idea of a two-tier system. And I would also just flag that if you do bring it in, especially in the near future, the people who are going to be left out of that are younger people who have stayed home for months over the past 15
well,
months.
look, let's put this to the government, Kate, because we've got the government here. So I know the government said today that people who have had 2 jabs, unlike Kate, at some point, perhaps you'll tell us tonight when, will be told that they can go to amber list countries. What about everybody else? When will we know that? And what about everybody else?
Well, the announcement has come just this evening. The plan will be to announce the details before the 19th of July so that people can plan ahead, and indeed those organisations responsible for airports, etc., can also start to plan ahead. And the idea is, I think, a very sensible one. If you've had a double jab, then it does mean that the requirement to quarantine, I think, can be relaxed. There are other issues, of course, families, children who haven't had the jab, and indeed part of the plan will be to work out a system whereby children can be tested so that they can travel with their parents and loved ones.
And what about people like Kate? Well, and others in our audience who wouldn't be double jabbed?
Exactly. So there will be, of course, contingency made and provision made for people who can't be jabbed for various good medical reasons. So
or just if they're not old enough.
Well, look, I think that the reality is, and in fact Kate said it in her answer to the previous question, the evidence grows all the time in favour of the break between people who have been double jabbed and the vulnerability to the virus. And clearly, as we get more and more of our population into that double jab position, then it does become, I think, much easier and freer for us to do the things we want to do.
But someone like Kate, we're in a situation tonight where someone like Kate and others in our audience, others at home, of course, who won't have their second jab by the 19th of July or in the weeks after that, at the moment, won't be able to go to these countries without quarantine.
Let's keep on getting as many second jabs in arms as possible.
So they won't.
I accept that there might be still people who aren't eligible at that time, but I just want to, take issue with Kate's point about somehow we're trying to create a two-tier society. All we're trying to do is to allow people to enjoy the pleasure of a holiday, which for most of us, me included, has not been the case for well over a year. And it seems sensible to me to follow the evidence about double jabbing and to now extend it to amber countries.
OK. Kate, sorry, Kate, I'm so sorry. I just need to bring some other people in. Hang on a minute. Joe, I can see you're shouting rubbish at your screen. So tell us what you're saying, other than that, obviously.
I am aghast at these plans. As for a two-tier system, you couldn't divide the country more than by implementing something like this. People who have the funds to be able to pay for a quarantine hotel upon their return, great, crack on. But what about the rest of us that can't? 9 children in a class of 30 are living in poverty, and yet people who can afford to take their children abroad are going to do so. I'm aghast at how the government thinks this is sensible, is measured. There's members of this panel that can't even work, and yet for people who have money, who are affluent, they're able to go on holiday. Some people here can't even pay their bills. I think the government needs to take a very long, hard look at the people who they serve and make some decisions and give some consistent messaging to people that are everyday people on the street. So that's how I feel, and I am aghast. You can have kids that don't have vaccinations travelling to and from, and the testing is not reliable enough to guarantee they will not be bringing a variant or any other thing into this country. So,
John, do you support this new development by the government?
Well, I would want to understand the clinical evidence upon which it has been made. And Robert says we have to follow the evidence. Well, let's see the evidence, because there has been some alternative evidence today, a study from Cambridge, which suggests that a cohort of health workers who had been double jabbed, it's an international study led by Cambridge, but double jabbed health workers caught the virus and transmitted the virus. So vaccination in and of itself does not make you bulletproof. It's a tremendous success.
So do you think more people? Do you think more people shouldn't be going on holiday then?
Well, I think we have to proceed with caution for now until we fully understand what is happening with this particular Delta variant. We shouldn't be here, of course. The reason we're here, as Caroline said, is because rather than red listing it, Boris Johnson gave it the red carpet. But we are where we are now with this Delta variant. And, of course, there's been a mutation. There's been a mutation in the Delta variant as well, where it's got a particular new strain which has been identified in around 40 cases in the UK.
OK, but just to be clear...
It gets round the vaccine.
Just to be clear, then, the Labour position is not that more people should be going on holiday. Quite the reverse.
No, the Labour position is that we should always follow the clinical evidence. And I do not understand what the clinical evidence is for this decision when we know that even with a double jab, you are still at risk from this particular variant. So I want to see what the clinical evidence is. And secondly, the government, as far as we understand, are not going to be vaccinating children. Vaccinating children in the United States, some other parts of the world are vaccinating children. So Robert says there's things to be worked out. If you're not vaccinating children, why would they be allowed to go abroad with their families on this scenario? There's lots of questions here that we really need to get to the bottom of.
Gary, you asked the question.
Yeah, thank you. The decision here is that the big issue is about our travel industry. There's a big march in London yesterday about this. It's almost been and become the forgotten industry. Our UK airlines, our travel industry, it's not just holidays that we're talking about. It's people who need to go away on business, again, to see their families. And airlines are actually really... They're in the last chance saloon now, our UK airlines. They've borrowed all the money that they can now, and once they've borrowed that, there's no more money in the pot. There's been nothing from the governments. You see the Euro governments, they've given handouts to Air France, KLM. The Germans have done the same. The UAE have done the same. The Americans have done the same. They've all bailed out their national airlines. And we're leaving ours out to dry. And along with that, it's not just the airlines, it's the whole travel sector, everything that's linked to it, thousands, millions, hundreds of millions of pounds worth of business being lost over the past 18 months. And we're almost at breaking point.
Donna.
Thanks, Fiona. I agree with some of the panel there when we talk about the two-tier system. I really feel very uncomfortable about people not being able to afford testing, where there is one rule for the rich, whether you're a footballer or a UEFA, or you're a rich family bringing your kids to your holiday home because you're allowed to go, or you're allowed to go to work in one of these countries. And I really feel that far from the Conservative government levelling up, they are creating a two-tier system completely and utterly. And it's very much a case of the haves and the have-nots, and it's not right.
And are you swayed by the idea that the government is suggesting that if you've had 2 jabs, at some point yet to come, we don't know when the date will be, that you will be able to go on holiday to amber list countries and come back without quarantining?
Yeah, as long as the data suggests that it's safe. But I mean, I know that Israel today have decided that they're going to vaccinate their over 12s. But having the vaccine, stops but I'm not actually sure. Does the vaccine stop you spreading it? I don't think it does.
No, it doesn't.
No, it doesn't. And you've made the point.
Exactly.
Victor.
Look, 3% of all infections end up in hospital, right? That might sound like a low number, but in percentage terms, but actually it's a lot of people, which is why we've got 90% bed occupancy. My personal view is that actually, I'm with Joe, I don't think it's an intended consequence of the government's decision, but it is an unintended experience of that decision. And I have to say, I'm quite confused. If it's a red country, you shouldn't be going, right? Amber? I don't get it. It's like, it's either green or you shouldn't be going. Exactly. I haven't booked a foreign holiday, and I won't be booking a foreign holiday, and I understand the pressures on the travel industry. But as I say, there is no wealth without health. There just isn't. And we have to do what we can to support the travel industry and the people who work in it. But I'm here because I want to protect the NHS. I want to ensure that it's here and can work through the pandemic and what happens after it. And I just think we should have an abundance of caution. And I think it's too early. I know people want to get off. I know that. They want to get onto the holidays. They want to go to Bermuda. They want to go to... I get it. But we can't afford to take the chance either way. And Jonathan's right, actually. The Delta variant spreads really quickly. It spreads really quickly. There is some evidence that there may be some vaccine leakage. But we have 40 cases of a Delta plus in this country. And we know that we start with 40, then it's 400, then it's 400. So I just think we've worked so hard. Let's just take a break. Let's just take a break. Let's not rush this. Let's not rush it. Let's have an abundance of caution.
And Caroline, as far as the Green Party is concerned, I mean, almost irrespective of the data, you want people to be flying less anyway. So this is good news that people aren't travelling abroad. That's not what you want them to be doing.
We wouldn't want it imposed in this way, obviously. And I just want to say that when it comes to the travel industry, I have a lot of sympathy with what Gary, I think, was saying, that we need to be supporting the tourist industry, the travel industry. We need to be supporting them with extended furlough. We need to be making sure that the business rates and all of those things are extended as well. It's quite extraordinary the government extended the restrictions without extending the support to businesses. But that's not a reason to open up. And you're quite right, the Greens do not want people to be flying as much as they do. But
and also, I'm just thinking,
we want to do it in a fair way.
Well, I'm just thinking in terms of what some people have said, Joe and others, and Donna particularly, saying it doesn't, you know, people who can, at the moment anyway, people who can afford to go and pay for all the tests, it's creating a two-tier system. If your manifesto talked about imposing a levy on anyone who took more than one return flight a year.
Exactly.
Isn't that creating the kind of two-tier system
I would love to know
that they're
what the
talking
panel
about?
think about that, because actually I think a frequent flyer levy is a fair way forward, and it's interesting that the Citizens' Assembly on Climate Change, a cross-party group of people who came together, cross-party and no party, actually advocated this, because what it means is that people can still go away for one holiday by plane every year without paying any more. And it's those people who are flying 1, 2, 3 times a month because they've got a second home, they are the ones who...
Well, it's any more than once a year. It's any more than once a year.
Yes, but I'm saying...
Never mind, 3 times a month, but more than once a year.
Flying once a year for their summer holidays that they've saved up for, absolutely. Of course, in an ideal world where we're not in COVID, that should be able to happen. What we're saying is that those people that are flying regularly, the more they fly, the more that tax goes up. But I wanted to come back to the point here as well about the dangers of this virus, because I think Victor's absolutely right, that the government should not be sending out messages that it's fine to be doing overseas travel again yet, because it does put at risk all of the sacrifices that we've made. We need to be protecting our vaccinated population, and we need to be making more people vaccinated. And so the idea that children can go away unvaccinated and then bring back the virus and spread it further, when we've already heard that 250,000 children were off school last week, I think, because someone in their class had COVID. It's too soon to be doing this. We need to make sure that we've got things in place like electronic passes so that it's much quicker to get through the airports. We're still having queues mixing at airports. It's only just recently that they've managed to get one terminal where people come back from red lists. Until then, people were still mixing. And so it's still too dangerous to be giving the signals that this government is doing.
OK, let's take another question now from Colette Osborne.
Thank you, Fiona. Good evening, panel. Do the government take rape and domestic violence seriously, considering the shocking exchange in Parliament referring to questions about a fall in prosecutions as jabber?
So, Colette, what you're referring to is Prime Minister's questions yesterday, where the leader of the opposition, Keir Starmer, was asking persistently about the drop in rape convictions. It's a 40-year low in England and Wales. He's asking a lot of questions about the government's policies. And Boris Johnson replied, one of his replies was, we're getting on with the job. They, Labour, jabber, we jab. Now, that sounds like you took offence at that.
Yeah, because it wasn't about vaccinations. It was quite a serious question, and up until then, you know, Prime Minister had a really good kind of, you know, what he said made sense. And at that point, I was like, hold on a second. Again, we're being mocked in Parliament. You know, I'm sick of hearing, basically in Parliament, you know, a load of ministers and cabinet ministers basically laughing about women, and not just women, but men. This is a serious issue, you know, and it should be addressed. And yes, I did take offence to it, Fiona, because I think it's absolutely disgusting. OK. Well, Robert, we've got you're the Justice Secretary. Did you cringe at that?
Well, look,
or did you think it was a good thing to say?
First of all, as somebody who prosecuted regularly serious sexual crimes and dealt with a lot of domestic abuse cases, this is no laughing matter. It's never been a laughing matter for me, which is why last week I apologised publicly for the low rate of convictions for rape cases in England and Wales. And I can tell you...
So 1.4% of rape cases in England and Wales resulted in a conviction last year.
Yeah, we saw a rise in the middle of the decade. We've seen quite a steep decline since then. And that is of deep concern to me, and indeed everybody involved in the system. The system has failed because of a multiplicity of reasons, including, for example, the appalling position where a young woman who has made a complaint of rape is told, look, we need your phone. We want your mobile phone. We're going to take your mobile phone from you, maybe for months. We're not going to give it back to you. And that gives that person an unenviable choice. Do they give their phone over with their life on it, or do they pursue the complaint? And too many people are put in that position, and therefore cases are not followed through. I want to change all that. And can I say, so does the Prime Minister. And I take on board what the questioner has just asked.
So what did you think, the jabber, we jab? Did you think good comment, or did you inside wish he hadn't said it?
I think at the end of Prime Minister's questions, both the Prime Minister and the Leader of the Opposition like to make a general comment about each other or about each other's party. I do not believe in the Prime Minister's mind that was linked to the genuine remarks he made, the apology that he too made about rape. Can I say this, Fiona? When he first became Prime Minister and I first became Lord Chancellor, one of the first conversations he had with me was about rape. And I said to him, I said, one of the big things we can do is increase support for women and victims by scaling up the number of independent sexual violence advisors. We're doing that now. We're spending this year alone 27 million. I want to increase the numbers by hundreds, because the evidence shows that with support, more women, and indeed men as well, can carry through their complaints through to proper investigation and prosecution. That's what I want to see happen, and that's what I'm going to work towards over the next few years.
Victor?
You know what, I do think that the Prime Minister does this alliteration. It was in his script, right? I don't necessarily believe that he meant it, but it caused offence. And because it caused offence to women, and we're talking about rape, he should apologise. It's straightforward. I just think he should apologise because it caused offence. I think that the situation is shocking. I think it is truly shocking. As the father of girls, I just think it's unacceptable. What I do think, and I just thought it was a good thing that you actually showed some contrition. You know, it's rare these days, you know, some shame and some responsibility. But let's be clear. There are a number of systematic problems in the system. You've mentioned a couple of them, but I think resources are also one of them. And I think there is a relationship between the resources we put in a public system and the efficacy. And when you cut a budget by 50%, you know, you're effectively taking half the water out of a bucket and expecting them to put out a bigger fire. It's not going to work. So I think we do need to look at the resources. But I think there's a bigger issue here. You know, I recall a question time a few weeks ago that I was on where we were talking about women's safety in public. And I said then, we need to educate men. We need to create a strategy for public spaces that are safe for women, and we need to ensure that women feel safe in public and in private. And I think that, you know, unless we can take the safety of girls and women seriously and strategically seriously, this will continue. So we need the police to have the resources to investigate. We need the criminal justice system to have the resources to prosecute. We need the public prosecution officers to have enough resources. But the thing that really upsets me is the cases of women who have not been taken seriously and haven't had the support. And it is outrageous, frankly, that 10 years, you've been in government for a while now, and I'm saying this I'm a crossbencher, right? I'd say it to any political party. It is simply unacceptable that you have women who have been faced with the most shocking, appalling crime, and yet they report that their mental health, their emotional support, their safety is not taken seriously by any section of public services. You have to get that right. You have to get it right for women that are raped. You have to get it right for girls who fear rape, and you have to get it right for both who feel unsafe in public and in private. And by the way, we need to put some money into women's refuges. We need to ensure that women everywhere can pick up a phone and get the support they need. I'm involved in services to women's refuges, and it's just not good enough. So, yes, we take the apology. Let's have the resources. Let's have the plan. Let's have women in charge of that plan so they feel safe. so we don't have this conversation again?
Hannah.
Hi, thank you. The government's announced a new crime bill. It included tougher sentencing for rape convictions, but it's pointless if the convictions are so low. It's a deterrent, but there's no deterrent there if it's a 2, 3, 4% of cases. It doesn't matter. It doesn't work.
All right.
More needs to be done about prevention rather than
yeah, absolutely.
rather than cure.
Absolutely.
Christina.
I think one of the things that we're missing completely is how long it takes for a rape case to actually come to court. If somebody's been raped, the last thing she wants to do is to have to not only go through all the terrible trauma of having to tell other people about it, have her phone confiscated, have her entire private life investigated, for anything at all that the defence can use to say, well, she's encouraged this, it's her fault in some way or other. But I'm sure that if I was in a position where I knew that it was going to be made public, and it will be, and this person was going to be walking around waiting for a court case to come up maybe a year, 2 years later, do I really want my mental health to suffer for that length of time, with that hanging over me? And I think there must be so many women who don't even report it because they cannot face what they will have to go through.
Well, it's
problem.
It's over half of rape victims withdrew from the investigations last year. I mean, but they did report it and they pulled out of it. So, of course, we don't know how many don't report it. Dale.
Hi there. Yeah, I hear all the panel about the women. What about men? What about gay men? I'm a gay man. We all get raped. It's not just about women. So this is really winding me right up. I'm really sorry, and I'm very, really angry. It's not just about women. It's about men too. Men get raped. Men get sexually assaulted. So in this bill, don't just concentrate about women, because men get raped too, and so do gay men as well. And that's rife. And this is what's been brushed under the carpet, and it's wrong on so many levels. So now the government, don't just concentrate on women getting raped. Men get raped as well, and gay men get raped as well, and I've heard about it, and my friends have had it. So just look at the bigger picture, not just winning. And yeah, sorry, that just got my goat.
Dale, you make a good point. We hear you. It is also true to say many more women get raped than men. That is also true. That's not to deny the male experience, gay or straight.
But women rape men. It's not just men that rape women. Domestic violence against men with women is high compared, and obviously men against women is good, it's high. But domestic violence against man with a woman, the only difference is a man doesn't report it as much as a woman does. That's the difference.
Yeah, listen, I hear what you say. I'm not sure that you're right. The only difference is they don't report it. There's no doubt that domestic violence happens to men and rape happens to men, gay or straight. Both happen a lot more to women. That's indisputably the case. But that's not to say that your concern is not legitimate.
Yes.
Robert, you wanted to come in.
Rape can only be, as a matter of law, committed by men. But Dale is right to talk about male victims, and the stigma for men in coming forward and talking about it is huge. So we get what you're saying there. Absolutely listening to you loud and clear. It is part of the strategy as well. We want more men to come forward and feel confident that they're going to be supported through a very difficult and traumatic experience.
Caroline.
Well, I think that Robert's apology was very welcome, but alongside an apology there has to be accountability. And as we've been hearing this evening, rape has effectively been decriminalised. That's what it feels like, I think, to so many men and women right now who are trying to report rapes. And I really worry that on the one hand, you've got the absolute starving of resources that have gone into the court case, into the CPS, into the police. You know, police have lost around 20,000 officers, so it's not surprising that there's fewer police there to follow those cases up. But it's also the case, as Christina pointed out, that the current system puts the survivors on trial. They themselves are on trial when they report a rape. So we need to stop this so-called digital strip search. We need to have a ban, I think, on sexual history evidence. I don't think that's relevant, and it shouldn't be bringing up in court. I think we need to have things like special advocates who can accompany rape survivors through the system, because it's really difficult and complex and stressful and so forth. We need to have, I think, proper review of the cross-examination rules. We might even need to look at potentially alternatives to the jury, or at the very least an education of the jury, because there are so many cultural rape myths in people's minds that some people feel that they're not getting a fair deal from jury trials. We need a sustainable funding model, and Victor's absolutely right to talk about the shameful cuts to rape crisis centres, and absolutely they need to be properly funded. But I think as well we need to be prepared to reopen historic cases. And I know that's a big ask, but we should be doing that. That is what justice demands. So there is a huge amount that needs to be done, and I'm afraid this review is basically rewarming some old pilots that have been already studied, and we don't really need more pilots. What we need is more action, more funding. When Robert first talked about the failings of the system, he didn't even mention the cuts to funding. So that has to be in there. But we also need to have some more ambition and some more urgency. This review has been 2 years in the making. We need to have action now, not waiting another 2 years before we have new rules so that people don't have to hand over their phones for months and if not years on end. That could happen now, and it should happen now.
John?
I agree with Colette and Hannah and others who have made have contributed. I mean, I did think that Boris Johnson's remarks yesterday were offensive and lacking in judgment. You're right, Vic. So he would have had it in his script, and he would have. Before he went into the chamber, he would have been throwing around lines with his advisors, and they said, "Oh, that's a great line, Prime Minister." Definitely use that in the Commons, and he'd have been determined to get it out, regardless of what question he was asked. But I think he should have paused and thought carefully before using that line, because it did rather demean him. You can't imagine a Margaret Thatcher or a Tony Blair using a line like that in the House of Commons, to be frank, about an issue of this sensitivity. I think we've got to be aware that the criminal justice system has suffered swinging cuts over 10, 11 years now, and that has surely had an impact on these conviction rates and prosecution rates. And I mean, I was looking at the data from the Home Office and the CPS and the Justice Department, Robert. I mean, it is shocking. I mean, it is absolutely shocking. I mean, like, over 52,000 rapes recorded by the police in England and Wales, only 843 results in a charge or summons, 2,102 prosecutions, 1,439 convictions. These are massive drops on previous years. So the cuts have surely had an impact, and I'm sure people appreciate the apology that you have made, but the test of that apology and whether that apology carries weight is, what are you going to do to turn around this absolutely awful record? And this record is on your watch, Robert, and I've not actually heard what you're going to do to sort this out.
Read the review. In the review, we have clear plans.
Tell us now.
Well, no, he has told us something, and I just need to get Kate in. Kate.
Look, I think the Prime Minister's comments were clumsy, but I think it would be a bad faith assessment to assume that he was trying to make a direct link to the conversation that had been happening previously. And I have to push back on some of Caroline's comments there. It's hyperbole to say that rape has been decriminalized. It certainly has not. It remains one of our most heinous crimes that we can commit. And I would also push back on the idea of educating a jury. I think that Robert's apology shows the extent to which this isn't a political issue. It's not one in which we use to score points against one another and attack the other side of the party. I think that every single politician on this panel representing their parties takes rape and sexual assault and domestic violence very, very seriously. And there seems to be very broad agreement that more resources need to be committed to help women through this process, and the men who are going through this process as well, and also to help actually gather the evidence, help the police with their resources, so there hopefully will be more convictions in the future, not by changing the law or changing the system or suggesting that it's been decriminalized, but by actually making sure we have the resources to get things over the line. And I think we need to work together on this, and I don't think it's one for political point scoring.
We've got time to just fit in one last question. Just in terms of decriminalisation of rape, those are the words, I mean, Caroline, I think that's what you were quoting, of the Victims Commissioner for England and Wales, Vera Baird. She said, we are witnessing the decriminalisation of rape. Those were her words.
It's not serious. It means to say that there's so little follow-up in the criminal justice system.
Let's take one last question. We've got very few minutes, but I want to get this in. A lot of people have mentioned it. Tim Down.
Good evening, Fiona. Panel. Will banning junk food ads before 9 p.m. really stop us eating what we want?
Victor, you support it?
There is evidence that actually it will. So I think we do need to do a lot more than just ban junk food ads after 9. I think there's also something about the responsibility supermarkets. I sit on the board of the Co-op group. I should tell you that. But there's more that we can do to educate people about good diet. I think there's more we can do to educate children about how to cook. I think there's more we could do about food poverty. I think we've almost slipped into the notion that food banks are part of the landscape now. I don't think that's a good idea. There's lots of evidence that the nutritional value of food banks isn't the same as being able... So I think there's a lot of things that we need to do. I think it's a small step in the right direction. We need to do a lot more. It's a public health issue, and almost a public health emergency in many places.
Ryan?
I think we need to acknowledge that for many people, even though taking away adverts for junk food before 9, many people don't have the option of buying more expensive, healthier food. Of course, every little helps, and of course, individuals have responsibility for the food that they eat and the choice that they make. But I think it's important to consider the fact that for many people, more expensive, healthier food might not be a direct option for them.
And just, can I just on that point...
Very quick, so I've got about 3 or 4 minutes left on the entire programme.
He just needs to point out that in many of the poor areas, that's where you'll see the chicken shops and the poor food shops.
Sure.
So it is about planning, it is about what we allow to happen in certain areas. Just saying.
Caroline?
Well, I think it is a small step forward. It's long overdue. I think it needs to apply to all platforms, and I'm deeply concerned about what is being sort of pushed on places like TikTok or in plenty of other places as well. So we need to make sure...
What about the fact that you won't be able to advertise a burger from a well-known burger merchant, for example, after 9 o'clock, but you could advertise a ready meal which actually has more fat?
Yeah.
Before 9 o'clock, sorry, yes, of course,
yeah,
before 9 o'clock.
So there are anomalies that need to be looked at, but I am glad that now the government is beginning to look at it, but I think it needs to be in the context of an overall food strategy, because people are right to talk about the fact that in many cases junk food can be cheaper and it fills you up quicker, and there's a real issue around social justice and poverty here, and that needs to be part of the food strategy as well. So I think that we need to be moving to healthier food, but enabling people to afford that diet, and that means changing access to food and an overall food strategy.
John?
I agree with it. It's something I've long been campaigning for. We face an obesity crisis in the country. Obesity causes cancer, it causes all kinds of very serious, debilitating chronic health conditions. It costs the NHS and society billions as well. And although this isn't the only answer to solving the obesity crisis, we should be taking advantage of every potential tool in our locker. We ban other types of advertising. The state intervenes around advertising for things like cigarettes and so on. Yeah. So I think it's entirely sensible.
We've got about a minute left, Kate. Now, a quick answer, if you wouldn't mind.
Yeah, this is the nanny state gone mad. I happen to agree with Victor that the solution actually is in education and teaching people how to cook, but there's no way that this is going to stop people from eating what they want to eat. That whole Scotch egg debate that we had last year about the government dictating very specific things about food was an example of what not to do. The fact that this rule means that they have to have exemptions for avocado and olive oil just shows you the extent to which it's a poor decision. The government should not be picking and choosing individual products that can be advertised on TV when it comes to food. Okay. Nanny state has gone way too far. We've had 15 months of restrictions on our lives. It's time to step back and leave.
I'm jumping in because we're almost out of time. So your own impact assessment, government impact assessment, said the restrictions will lead to children eating the equivalent of a single Skittle less every day. with restricting advertising
Well,
in
it
this
comes
way.
on top of changes to sugar content, for example, on drinks and other types of food, which I think have had a major impact. I agree with the panel. There's always more that needs to be done with regard to nudging and encouraging people, particularly children, to
and you think this will
adopt
work?
the right habits. Look, I think it's a good start, and I think, remember the audience here. We're talking about children and young people and focusing on them and making sure that they are guided in the direction of healthy eating.
I'd like to have talked about that longer. I'm sorry, we are out of time. Thank you very much to all of you for coming in here today. Kate, thank you very much for joining us down the line. To our QT50, thank you as well. And, of course, to you at home. From Question Time, bye-bye.